Ladies and gentlemen, thank you so much for joining me today for this presentation about how at COSH and Parsec are changing the history of healthcare. But before I go into the details of what we are actually doing here about our product, let me first share a little bit about myself. You see, I am a big car fan. This here on the picture is my BMW 3 Series X-Drive. I love taking this car out in the snow. And a few years ago, I was on vacation in the Italian Alps. So one fine afternoon, I went for a little drive, and I was a little bit too overconfident. So I turned off the traction control, and I slid into a ditch. It was a huge mess. So I was rushed into hospital, into the emergency room. Everything was crazy. People were asking me all sorts of questions, and well, I guess because it was in Italy, no one spoke any English. Okay, so I couldn't give the people all of the information that they actually needed. And of course, I don't carry my medical information with me everywhere I go. So it was very, very difficult to get information, my health information, across to the doctors. But you see, the crazy thing that happened was that my car was taken to the local BMW dealership. And all they had to do was take my key and put it into one of their, little boxes that they have, and they knew everything about my car. They knew it down to the last oil change. And when they plugged the car into the computer, they knew all of the diagnostics that they needed to fix my car. So, if it's so easy in the car industry, why don't we have that in healthcare? Probably all of us have used the internet to buy airline tickets, right? And most of us, I think, today already use e-banking solutions. So we can do it in the car industry. We can do it to buy airplane tickets, and we can do it for the banking, but not in healthcare. You see, right now, I can go on my phone and I can see the exact amount and time I paid for dinner before my accident, but I don't have the documentation to see what was going on at my crash. Well, that was the truth until now. Today we have an amazing platform that is called COSH. The COSH platform takes all of the different information that is now dispersed along different healthcare providers and actually puts them and aggregates them to the common denominator. The COSH platform actually takes the information and gives it to the patient, putting the patient into the center of care and actually giving the patient full overview of their health and their health treatment process. During my studies as a medical doctor, and also now that I'm working, I travel a lot. So I lived for a while in the United States. Currently I live in Ljubljana, Slovenia, but I travel to Berlin a lot. So I had to visit different medical institutions in all of these places. So my medical information is dispersed into different places all over the world, but no one clinic has my full entire healthcare record. Well, that's what we do today. COSH, using the technology from Vitali from Parsec, the Tiani Spirit system, Sistema, and Cisco's hardware, we combine all of this to give the information to the people. So it doesn't matter where the hospital is. For instance, my GP is in Ljubljana, right? And from his waiting room, we can actually see the University Clinic Center. But those two systems are not talking together. Using our platform, the COSH system actually gives all of the information available not only to the patients but also to the doctors. Information that we have is giving the availability to see the personal health record, to have access to all of the medication instructions, the prescriptions, everything that's going on. Remote patient monitoring allows chronic patients to do their measurements at home, and without going to the doctor, they can evaluate what's going to them and act before it is too late. With the patient record, we can see all of the information regarding the allergies, and we can also do appointment managing. So, as a patient, I know when my appointments are, and also I can book them. With video communication, it's been never easier just to get an appointment with my doctor without the need to traveling someplace else. Right now, if I have an accident, if something's wrong with me, I can actually have video communication with my doctor in Ljubljana. So, this is sort of an iceberg, right? We have the Cisco hardware on the bottom, then we have the Tiani Spirit in the middle, and then the Vitali platform on top. And this is what COSH does. So we still need to have the hardware in all of the different places, in the hospitals, in the GPs areas, we need wireless technology, which is a must today, to bring the information to the people. So what I can say now is that I'm so very, very excited about the future of healthcare, and let's write e-health history together. Thank you very much.